Hey, everybody, welcome to our latest podcast episode. We're here today and we have the brilliant Dr. Maria Hinchey. Why am I having a
Myriah,
hard time saying your name, Dr.
come on,
Hinchey?
Matt.
Myriah. Dr. Myriah Hinchey, who is a good friend of ours at Tick Boot Camp. We had the honor of meeting her in person several times. Rich is laughing at me, making fun of me, so we're having a kickoff to this podcast interview. But we're really here to talk about your LymeBytes Symposium. It's an in-person event for both doctors and patients to collaborate and work together to fast-track their healing journeys and also share research being done at the medical professional level. So it takes place on November 14th and 15th in Florida, and Rich is actually going to be there in person as well. So, Dr. Hinchey, if you can say hello, and then we're going to really geek out at what this symposium is going to look like and why everybody listening to this podcast episode should either sign up to attend in person or virtually, because you have a virtual component as well.
Right. So, hi, everyone. Thanks for listening to me again. I'm happy to be here.
So, Dr. Hinchey, this is, and I can't pronounce your name unlike Matt. This is actually a first for Tick Boot Camp. We've actually never done an endorsement video, and I do want to first share with everyone, we are not being paid to do this. Those of us who follow us know we don't even have a bank account, so we can't be paid even if we wanted to be paid. We are doing this because we really believe in this particular doctor and the work that she's doing. And what we always try to do here on this podcast is we try to introduce folks to new opportunities. Different people plateau at different points. Different people get stuck at different places. And when you want to work with some of the top doctors, it can be difficult, in part because of geography. Sometimes you're not living in close proximity to an ILADS trained doctor. One of the things that we here at Tick Boot Camp are advocating for. Sometimes it's just too expensive to work with a doctor. And in many cases, the best doctors like Dr. Hinchey have long waiting lists, that there are only so many hours in a day and there are only so many patients that a doctor like Dr. Hinchey can see. So one of the things that we really admire about this doctor in particular is that she's trying to expand her capacity and her reach by doing things like coming up with a symposium like this one. So we are doing this because we believe the community needs something like the symposium, and we need to encourage people to move into the space, because there are really two different, I think, extremes. One extreme, it would be being lucky enough to get into Dr. Hinchey's practice. And I think your waiting list is over a year at this point, is my understanding.
It's a little bit shorter. We've finagled things and we've been able to get it down to just over 6 months. So it's much better than it was a year ago.
Well, thank goodness. The last time we spoke to you, it was longer, right? But then there's the other extreme. And the other extreme is some people go into inpatient clinics like a Sanoviv or a Clinic St. George or Invita, and there's a place for that. But there really aren't enough opportunities for patients, at least in our view, to have something in between. And I think this is that in between where you don't have to go inpatient and you don't have to spend that kind of money inpatient, but you can have the benefit of working with and listening to and interacting with some of the top Lyme doctors and some of the top chronic disease doctors in the world. So that's why we're doing this. We think, folks, this is a really important opportunity that you should take advantage of. We believe you should go to this this event in person. I will be there. I hope you do attend, and I hope you do come and say hi to us. At those of us from Tick Boot Camp will be attending. But I also, if you can't come, if you're not feeling up to being there in person, I want to strongly urge everyone to come and go to this event virtually. And let me give you my perspective, and Dr. Hinchey, I'd like you to give me your thoughts on this next argument I want to make. What I find is that when I'm in an immersive environment, that my onboard diagnostic system allows me to move from one place to another based on something that resonates with me. And the more volume of information, the more volume of opportunities I have in this immersive environment, I find that I learn the most. So can you share with us, is that a part of your philosophy? Is immersion a part of the philosophy? And do you find that with your patients and folks who go to the symposium, that the greatest benefit that they have is that they can be in a place for a couple of days and have a large amount of information available to them and allow their onboard diagnostic system to let them know what is resonating with them, and maybe that's the next step for them?
Yeah. So, I am definitely that person where even though I'm really good at multitasking, I do much, much better when I immerse myself kind of like in the next task or the current task, like right in front of me, and just give it kind of like my all. That's just how I'm wired. And so I do think a lot of people are wired like that. And I think that, you know, when you are immersed with not only some of the top clinicians, but also all of these vendors that have all of this adjunctive therapy that you can do, you know, as well as other patients that are going through the same things and other clinicians trying to learn, you know, it just really builds this community and this support. And there's a big piece of this. Sorry, I'm going to go off on a tangent. There's
That's
a
okay.
big piece of this healing journey, whether it's Lyme and vector-borne diseases or like mold-related illness, PANS, PANDAS, long COVID, vaccine injury at this point, like where I think people are just so dismissed and so gaslit and so isolated that you just feel like you're completely alone. And even though like you might have your Lyme literate provider that you're working with that makes you finally feel, you know, feel heard and recognized, you know, you still feel like you're all alone. And so again, like being in this community where from multiple levels, people have your back, whether you're a provider or a patient, right? Because being a provider, you know, I've been doing this for 20 years and the first 10 years was really lonely and it was really scary because I couldn't fall back on a standard of care. I couldn't look to, you know, I mean, God forbid, Infectious Disease Society. I mean, am I allowed to say this? Like, we don't want to hear anything that they have to say.
You're supposed to spit after you mention them, but you
can. No, like horrid, right? So like, who do you turn to? So luckily I knew about iLads. But I'll be honest, like to me, especially starting out, like iLads was scary. You know, there was a lot of really, really smart people talking about a lot of research and, you know, I didn't really know like how to take that back. So thank God for the people that I mentored with, like Tom Moorcroft and Nancy O'Hara and Richard Horowitz and Neil Nathan and, you know, Stephen Buhner and all of the books and things that I read. But still, it's like, you know, you go to one event that happens once a year, you know, and anyways, it's very isolating. So I feel like having all of these different threads of support, right? And the different connections that you make and like the friends or buddies or new colleagues that you make that connection with that you can actually like pick up the phone next week and call and say, hey, you know, what about this patient? What about that patient? To me, that's an invaluable part of this experience. And so, you know, we have like our Friday night beach dinner, we have our lunches, you know, we kind of have everything orchestrated so that you're doing it as a group, you know, so that you have more of a chance to talk to, meet and pick each other's brains, so to speak. And then I really try to make the conference, how do I want to say? Like, I try to make the conference built off of a lot of the principles that, you know, we all try to teach our patients regarding lifestyle. So, you know, we provide healthy, balanced meals that are gluten-free, dairy-free, sugar-free. You're not going to find sodas or desserts or, you know, things like that because, you know, we all are trying to walk the walk for our patients. And we want to provide, you know, a lot of the people that are here, they've had their own health journey. I mean, let's face it, what % of Lyme literate physicians are there because they had to treat themselves, right? And battle this stuff themselves or a loved one. So, you know, it's really important for all of us to have a healthy setting and healthy, nutritious food, you know, to be able to support us throughout the weekend as well.
Quick question to jump in here, Dr. Hinchey. So a couple of things I want to just highlight, and you can tell me if I'm wrong or right with some assumptions here. This symposium is not meant for people that are just your patients only. It's open to everybody, correct?
Oh, absolutely.
Okay.
Anyone who wants to learn the truth about Lyme and other vector-borne diseases, COVID, PANS, PANDAS, mold-related illness.
And it could even be a friend, a loved one, or a family member of a patient to come and learn to help that person in their life as well, correct?
Absolutely.
Okay. And what's really cool about it is they're going to really be able to benefit, and I'm quoting your website, but I love the wording, an intimate setting that fosters direct interactions with leading researchers, industry pioneers, and innovative clinicians. But why does that matter? So now I'm going to kind of give you my take on that, which is I like the wording, so I wanted to repeat it. But that matters because when you're a patient or you're a loved one of a patient, it may take, in my case, it may have taken me 8 years to get, a little bit of health back to feel quote unquote kind of normal again. But that didn't have to be that long. So if I had access to the resources you're going to have at your symposium, maybe that could have been a 2 or 3 year journey, right? Or maybe even shorter. So this could fast track the healing journey with access to all these professionals all in one place, being able to crowdsource and just get all that information from a whole bunch of leaders in one space, which is really cool. So the other thing I want to share about this is you talk about the innovative therapeutic devices and how if somebody comes, they'll be able to explore the latest complementary and adjunctive treatments designed to enhance patient outcomes and supportive healing. But now, again, I read that obviously, but let's talk about what does that mean? What kind of vendors, doctors, and devices will you have there to discuss and share? Can you give us a little bit more detail on that particular piece?
Absolutely. So what I would consider to be adjunctive treatments would be using any sort of red light, whether it's far infrared, near infrared, or any red on the spectrum, using hyperbaric oxygen therapy. So OxyHealth will actually be there with some of their chambers for patients to demo or get a treatment. Relax, far infrared sauna will be there. Therasage will be there. I'm trying to think who else with actual devices. We don't have PMF or PMA like we have in the past. I think that's basically it for devices. Then we have all of the major specialty labs, that are doing specialty testing from mold-related illness to Lyme and other vector-borne diseases. We actually have 1 or 2 mold remediation companies there. So like actual mold inspectors that know what they're talking about and how remediation needs to go, which is a huge thing that often goes very, very wrong. And then we have some of the top supplement companies there who, again, specialize in treating like these 4 things, not just like your run of the mill, all of the supplements that exist, but like, the niche companies like Alight, which is Jill Krista's company that she started to help with mold recovery, or NutraMedix, which specializes more in vector-borne disease herbs, Lymecore, which is my company, that I started to, to support vector-borne disease healing. I would say those are kind of like the main categories, whether they're testing companies, niche supplement companies, or these adjunctive devices.
So let me weigh in on this, Matt, because the first time I ever went to a seminar, there were 2 things that I really enjoyed. I went to ILADS last year for the first time, and again, ILADS again this year. And the first thing that I thought was really cool was, in many cases, we had, an online relationship with someone or a Zoom relationship with someone. And it was really cool to connect in person with so many of the really kind people that we had met over the years, and to again, just have that connection made real, because we have people, we now have real relationships. But the second thing I really enjoyed about ILADS, both last year and this year, were the vendors. I just didn't know there were so many opportunities to purchase tools that could shorten your journey. And I don't think most patients have access to that. And if for nothing else, I'd like to strongly urge people, if they have the ability, to fly down or to drive to this event, so that you can meet with the vendors and see what tools are out there that you're just simply not aware of. Matt and I have been doing this for 5 years, and 99% of the people that we had met last year at the at the vendor portion of the event, and 99% of the people that were there this year, we just didn't know they existed. We didn't know what tools they had. We didn't know what opportunities there would be for folks. And one of the things that we learned from the recordings that we did last year was that some of the largest downloads came from vendors, because the community doesn't have access to enough of those vendors. So that piece alone, quite frankly, I strongly urge people to come to. You'll really be blessed by getting to meet some of these unbelievable entrepreneurs who are doing really cool things to help you shorten your healing journey.
Yeah, and if I can add, I think, if one had enough time to go around and talk to each different vendor that's there, the amount of knowledge that you would gain just from the vendors, like not even stepping foot in the actual classroom,
I agree,
is amazing. And also we have have you guys heard of TruDose? Have you met Elena or Tapley or heard of the company TruDose?
no.
No.
So TruDose is our platinum sponsor. They how would I explain this in a nutshell? So do you know what PRP is?
I don't think so.
Okay.
No.
So it's platelet-rich plasma. So they take blood, and it depends on what your platelet count is on how much blood would be drawn from you. And then it gets put in a special centrifuge. And this centrifuge basically turns your blood into platelet-rich plasma. Now, platelet-rich plasma, the platelets are very healing, and they actually direct a lot of immune activity. And I'm going to take something that we could talk about for an hour and summarize it in 1 minute. Basically, it kind of jump starts or resets the immune system. And I don't know how, but it also is extremely soothing to the nervous system. And that, in conjunction with a solid treatment protocol for whether it's vector-borne disease or mold-related illness, etc., is having some really amazing, amazing results. So they're going to be doing a half-hour presentation. And, just for anyone who's listening, go to their website, go to TruDose and look up what they're doing, because it's really amazing. And the thing that I love is it's harnessing the healing power of your own body. This isn't taking stem cells from someone else. This isn't getting an exosome. Like, this is your own platelets that are being used to soothe and stimulate your body. So
Wow.
It's pretty cool.
That is fascinating. And maybe, Dr. Hinchey, we can do a follow-up podcast after your symposium with you and them, because that's something I think that could be really valuable to do a deeper dive on, to your point, maybe in a full deep dive, 1 hour and a half discussion, possibly.
Yeah, that would be great. And something too to throw out there, we're going to try doing something new this year. I hired a videographer, and he's going to go around and he's going to do little interviews with all of the vendors, because I feel like the thing that's missing, like with the virtual piece of this, is that the people at home never get to interact or see anything with the vendors other than their websites and their logos. So we're going to try to bring the vendors to you at home. We'll see how it goes.
Look, I think that's a great idea. I really do think it's a great idea. We tried to do some of that at this last conference, but unfortunately, we had 64 people we had to interview, and it just became too much. But I think it's a really good idea. I think getting the vendors to the patient community is really, really important, and I think it's one of the places where we unfortunately, at least on our platform, haven't been able to do enough of. So I'm really happy to hear that you're doing that, and we're certainly going to promote that portion of it as well. But one of the things that I learned at the Alight conference in interfacing with the vendors is how important it is to connect the vendor who is providing a particular type of service, whether it be testing or different type of treatment, with your doctor, and how there is this crossover between the testing the vendor would want the doctor to do and the information that the doctor can give to the vendor, so they can specialize the treatment for you. I mean, if you are chronically ill, you're an outlier. That the generally accepted medical practices are not going to work for you, and we have to make sure that we're being very precise with the type of treatment that you're getting. And it's not enough to just have a specially trained doctor. You are going to also need to have specially trained testing companies. You're going to need specially trained supplement companies. You're going to need specially trained, pharmacists, compound pharmacists. I mean, you need that whole spectrum of people so that you can have that type of precision care that you need. And we're just not bringing enough of the vendor piece to the patient community and helping patients understand how they can work with these vendors and have these vendors work with, or have these entrepreneurs work with their doctors.
And you are so right. And I have a really good example that really hits your point home. I have had patients where before seeing me, they heard of, like, let's say IGeneX, and their doctor, their PCP, who didn't know anything, went out on a limb and ordered the test for them. And let's say, like, it was a Western blot. And, you get an IgG and an IgM Western blot, and you get like a CDC/State of New York result, and then you get an IGeneX result. And even though I would have interpreted that test because of the pattern of antibody production to the various KD bands, along with the symptoms, because remember, this is a clinical diagnosis. We use laboratory results as a piece of our clinical diagnosis, not even to confirm or support, but just as a piece. So this patient came to me, he had had a test done 2 years ago, but he was told it was negative because the words said negative. So to your point, like if a doctor is going to order a test, a doctor needs to know how to interpret that test, right? Because there was this person's answers, they had them for 2 years, but the person that looked at the test didn't know how to interpret it right.
Crazy. So I want to talk about the virtual component, because I think there's going to be a lot of people listening to this podcast interview that probably aren't well enough to travel, but would love to be there. So they're probably considering, do I want to, spend the money and attend virtually, and what am I going to get out of that? So can you speak to Dr. Hinchey, what the virtual experience is going to be like for those that can't attend in person?
Yes. So the virtual is going to be the exact layout as the conference is, with all of the expert clinicians giving their lectures. So they'll have access to the slides. They will follow along with the lectures live. And then this year, they also will have full access to all of the recordings. So it isn't going to be like, I want to watch this one and I can just go on and watch that one. It's going to be like, here's the recording of the whole day, day 1, and the whole day, day 2, and they can scrub through it and find what they want to watch. But everything will be there laid out, and they will not miss a thing. And then, like I said, we're going to try to bring the vendors to you during the first vendor break of the morning, as well as the vendor break in the evening. And then anything we didn't get to, we'll play kind of at the end of that. And then, when the recordings are available, we'll probably just have a whole stream of all of the vendor information that they'll have access to as well.
That is awesome. So we're coming to the end of this promotional event. So I thank you for being our first, Dr. Hinchey. And so can we just, Matt, as we wind down, give the folks the specific information about where they can go to register for the program, and of course remind everyone that I will be there. I hope many of you join us there, and any folks who are members of our podcasting community, I'd really love to meet you. It really has been awesome over the course of the last couple of months. Matt and I have had a chance to meet people like Dr. Hinchey in person. When we first met at the I guess last year I met you at the Alight event, although you blew me off. You didn't come for the interview, but
That's not true.
And but we did get to meet in person in all seriousness at the when we were all walking on the runway, where Matt and I were fish out of water, but Dr. Hinchey was not.
Oh, yeah.
And
did you see the video? I was the only person who ran to the end, posed, and ran off that stage.
And then again, it was awesome to meet so many really cool people at the Alight conference this year. So I do want to strongly encourage folks to come to this event live if you can. Certainly don't feel any pressure, but if you can, we'd really love to. I'd love to meet you. If you've been one of our followers for any period of time, I would really love to meet you. It's really been a blessing for me to meet so many folks that we had worked with and met, and at the at the fashion show event, the Fashion Week event, we met actually a number of different patients who were on our podcast, and it was a real blessing. So please consider coming. I would really love to meet you. And Dr. Hinchey, can you give just some more specifics on how people could either sign up and come in person or sign up virtually?
Yes. So first of all, I'd love to give your listeners a discount. So
That would be awesome.
I'm going to make up a code, and then I'll have my IT person program it in. Let's do TBC 100. So that'll be capital T as in Tom or Tick, B as in boot, C as in camp. Why don't I just use the words? And then 100. And that will take $100 off of your ticket for in-person or for virtual. So I'll make sure it's unlocked for both. So you can go to LymeBytes.com, LymeBytes.com. And then you just decide if you want to do the in-person or the virtual. And then when you get to the checkout, there should be a place for you to enter the coupon code. And again, put in capital T, capital B, capital C, 100, and that should take $100 off your.
Well, that's awesome. So Matt, we have to make sure we get that up on our social media as well.
Yep. Well, we'll put that in the show notes. So we'll have a hyperlink to lymebytes.com with the discount code in the show notes of this podcast. And we'll also put it up on our social and our website as well to get everybody out there, with that discount code. So that's great, Dr. Hinchey. And we can't thank you enough for coming back to talk about this event. I wish, frankly, I had something like this available to me when I was at my worst, because I know it would have helped me shortcut my healing journey. And we encourage everybody listening to go. And if you can't attend in person, attend virtually, because we know working with you and everybody you're going to be having at the symposium will help everybody listening to this podcast. So thank you again for doing this great event and coming back on our Tick Bootcamp podcast.
Thank you so much for having me. It really means so much.